The physiology of high blood pressure and how to track your blood pressure. Blood pressure readings are notated as the systolic pressure over the diastolic pressure. The systolic pressure number is the highest pressure reading when the heart is in a state of contraction. The diastolic pressure number is the highest pressure reading when the heart is in a state of relaxation. So, the typical normal blood pressure reading is 120/80, measured in millimeters of mercury. This is a standard normal value, but some people have slightly lower readings and some have slightly higher readings, but these are still normal blood pressure readings. The physiology of blood pressure is a little more complex. Blood pressure is determined by a relationship of two independent things. The first thing is the cardiac output, which is the amount of blood volume that the heart pumps in a minute of time. The second thing is the peripheral vascular resistance, which is determined by the internal blood vessel diameter, the length of the blood vessel, and the viscosity of the blood. All of these things combined together account for the levels of pressure in the blood vessels. When you consider just how high the pressure can actually get, you understand the amount of damage that can be done to surrounding tissues. Now, this damage doesn't happen right away, but sustained high levels of blood pressure will do damage over time. Many things can control why blood pressure levels can be high or low, such as genetic factors, endocrine factors, and other disease processes such as hyperlipidemia and diabetes. In people who have high blood pressure, the increased force of blood flow from the heart on the artery walls may cause them to develop thicker, stronger structures. This is why so many different blood pressure medications exist, as there are many different targets that can be approached to try to lower blood pressure. Medications can act directly at the blood vessel level, at the level of the kidney, at the level of the heart, or even at the level of the central nervous system. Gaining some understanding of the physiologic aspects of blood pressure can make it understandable that blood pressure is a dynamic and complex concept. Automatic blood pressure monitors are excellent devices to keep track of your blood pressure. They are easy to use, they allow the measurement of blood pressure to be in your control, and they provide fast readings. If you are someone that has high blood pressure and you need to know if your measurements are high or if your medication is helping to control your levels, these devices are a must. There are a few things you should understand when you use these devices. The best way to utilize their function is to record blood pressure measurements at multiple times during the day. This way you can determine what your average blood pressure is. When you get a high blood pressure reading, don't panic. What you need to do is sit down and relax and rest. Then, repeat the measurement in about 15 minutes. Most often, your repeat measurement will be lower. If you have subsequent high measurements, it's best to contact your physician to ask them what you should do. If you are on medication prescribed by a physician, you will probably need to discuss your medication with your doctor. The point to remember is that one high blood pressure reading is simply a number. So, to be able to use data that is accurate and actually means something, you must have multiple readings of your blood pressure. High blood pressure does its damage on the body when it is a sustained condition. High blood pressure over a prolonged period of time is harmful to the body. When this occurs, you have the most risk of developing complications such as kidney damage, chronic kidney disease, and brain damage, stroke. One of the most important things to do is to make sure that you have the correct blood pressure cuff size when you measure your blood pressure. An incorrect size will give incorrect readings and won't be helpful in treating your condition correctly. The other way to make sure that you get an accurate reading is to make sure that you are seated in a proper sitting posture. Sit upright on a couch or chair with both feet flat on the floor under you. Automatic blood pressure devices are an excellent tool for you as someone with high blood pressure, and they will help your doctor treat your condition properly if used correctly.